Something that some patients sometimes find challenging about taking an oral daily medication is obviously being consistent with it. I think there are some folks that find that taking a daily pill is actually easier because they can build it into their routine, but I think getting up to the point where you have that habit of taking something every day is the hard part. The oral medication that we use for severe psoriatic arthritis is called a JAK inhibitor, the Janus kinase inhibitor. A lot of these medications, the reason that they're dosed the way that they are is because they leave your body after a certain amount of time. If you aren't taking them as prescribed, you're basically setting yourself up to not have a consistent level of medication in your system, and then you're kind of having these ups and downs in between doses of medication. Typically, the most common recommendations that we make are to have a pill box. You get that visual reminder, it's sitting on your counter somewhere safe, and you can see, oh, did I take my medicine today? Did I not? And then also having a phone alarm. We like to have a few phone alarms go off. I always, recommend that you don't just do it as like a calendar reminder. You want something that's actually a reminder app or something that's not going to disappear the first time you unlock your phone. Something that you really have to go in and acknowledge, yes, I did this. One thing that, I think is a good thing to do if you can is to sometimes carry a few pills with you. Have a little pill box that you leave in your bag, your work bag, because sometimes you just feel like I just really can't take that medicine right at this moment. I haven't had my coffee. I haven't had anything to eat. I just need an hour or two. Or just having, 2 or 3 pills in your backpack means that if you did forget to take it at 7 a.m., maybe you have another alarm that goes off at 10 o'clock and then you remember to take it at that point. So just setting yourself up for success, I recommend that people just have a few backup strategies. The other thing that works for some people with psoriatic arthritis is to keep their medication with something that they do every day as a routine. So if you, without fail, are going to be brushing your teeth every night before you go to sleep, keep your medication with your toothbrush. It's a visual reminder. Again, you see it and you just have to get it done. But whatever it is, try and pick a time of day that's not super chaotic for you. So if mornings are really hectic and there's just no way that you're going to get medication in at that time, pick an evening slot. That is just a less chaotic time. You're going to be home, you're going to be doing, whatever your routine is, and then you can take it at that time. There are different options out there, but I think really trying to brainstorm with your medical team about what's going to be best for you. It's important to recognize that you're also part of your medical team. Like what you are capable of doing is a huge part of actually treating yourself.